we've got a few people in person and then a few people online.
Okay.
So if you want to introduce yourself and then go ahead and start your presentation, the floor is yours.
Okay, let me just get this back into the slideshow format. Here we go. Okay. Dr. Hasma invited me to participate in this activity because he said that he hadn't had any cardiologists participate before, and I may provide a different type of experience. Also, I'm probably would be considered a non-traditional medical school applicant back in the day. I went to medical school from 2002 to 2006, so that's where my experiences are coming from. My journey through my education started with thinking that I would be a psychologist. So I got a degree in a bachelor's of science in psychology. And it was about midway through college, actually, not a lifelong desire, but midway through college that I decided that I should be a physician. Mainly because when I was taking psychology courses, I found that the ones that were related to physiology and health psychology and such were really what fascinated me. I had always wanted to be of service. I had a strong desire to do something to relieve suffering in people, and I found that probably the combination of understanding physiology as well as psychology would be a really good thing in medicine. Nowadays, that is actually found to be valued. People who are applying to medical school with sociology backgrounds and humanities and arts backgrounds are in a lot of schools now pretty favored. So that was, I think, just kind of transitioning at the time when I was applying for medical school. So I'll tell you more about my journey. So my degree was in psychology, and I really applied twice to go to medical school. I had to have some perseverance there, but the medical school I decided on actually was Drexel, and they had a very strong holistic approach to medicine, which I liked the idea of. And at the time, we're just starting their pioneering of teaching doctor-patient communication skills. And I really liked the idea of that. So that's where I settled. That was in Philadelphia. And I stayed at Drexel for my internal medicine training. It gave me an opportunity to have both a suburban experience as well as that downtown inner city urban experience, which allowed me to understand really intense disease processes in people who did not have the literacy, health literacy, and did not have necessarily the financial support for their medical care, as well as those who were highly educated and did have financial support, and treating patients in those along that continuum was very educational for me. Now, that being said, after spending 7 years in one place, I thought it would be a good idea to go and get training from other types of clinicians, internal medicine, as well as cardiology, at different expertise and a different culture of providing medicine. And so I went to Marshall University, which some of you may know is in West Virginia. So that was a completely different experience. I got to interface with a different culture, different values, different decision-making processes in medical care, as well as different cardiology disease processes. I came to University of Utah at recommendation actually from one of my mentors in Philadelphia to the Heart Failure and Transplant Fellowship, which gave me a really good understanding of the different ways that I could be practicing heart failure medicine, both in the academic environment as well as more of a private practice environment, because it was at the University of Utah as well as at Intermountain Medical Center. And that helped me inform what my goals would be in going forward with my practice. So applying to medical school, it was, thinking about this, I have, a lot of memories were stirred up when Dr. Haslam talked to me about this. And there's a lot of challenges in applying to medical school. And there's no one right way to do it. I think keeping yourselves as diverse as possible and trying to foster yourself as a well-rounded person is probably going to give you the most success in getting into medical school and into residency programs, as well as having success just being a physician. So choosing courses is really important to really educate yourself in all the different ways that you can be as a human being, as a physician. And I mentioned earlier that choosing courses that aren't just heavily into science, which of course is important, but also engaged more in the humanities. So making sure that you're taking courses in art and art history, in comparative religions and psychology and sociology, so that you're understanding your patients well. And that helps medical schools know that you care about the whole person, and those are the folks that they really prize. And then choosing experiences in medical school that might be extracurricular or volunteer, that's going to fill in some of the gaps. Experiences that might be applied science experiences, volunteering experiences that help evolve some of your interests. And then going about the process of researching what the medical schools are about, choosing the programs that you're going to apply to, casting a wide net is really important. Getting a diversity of schools, I think, is important. I think that was part of my process in applying twice for medical school, is I had it narrowed to one type of school, and I didn't even realize that Drexel was a program that would really fit me as a person until I started delving in on my second time around. And then looking, that whole MCAT process. I don't know how many of you have already gone through that. I took a very good MCAT board prep program that basically taught me what the purpose of the exam was and why they ask questions the way that they do. And I think that really helped me do well on my MCAT performance. And then I'm going to spend quite a bit more time on the personal statement is the goal of this session. The purpose of the personal statement is one, I think probably one of the most important components is demonstrating your communication skills in written form, conveying your own personal qualities, trying to separate yourself out, let them know who you are beyond your grades and your MCAT scores, and sharing what your values and your goals are. So looking at those more closely, it's really important to share with your communication skills. We spend as physicians pretty much all day communicating. We're either communicating with our patients or we're communicating with our nurses, both in the clinic and in the hospital environments. We're communicating with patient family members. We are communicating with other physicians. We're communicating a lot in written form. Our medical record keeping needs to be easy to read for others. It needs to be organized. It needs to flow well. It's really got to convey comprehensive information without extraneous information. And if you can communicate in a style like that for your personal statement, that is really going to go a long way to an admissions person having confidence in your ability to be a good physician. Not everybody comes out of college with those communication skills to write a good personal statement like that. Our English classes should prepare us, but not everybody takes that naturally. So if you're one of those folks, it's good to have somebody help you with your personal statement to make sure the grammar is down, that it flows well. And that's going to help the admissions team know that you are a good communicator, and that written form of communication is really important. The other reason that communication is important is because patient prognosis really depends on it. This is why the admissions admissions teams value it so much. You got to be a team player. You got to communicate to be a good team player, but also your patients, if you're not communicating your thought processes and choosing your diagnostics, what the risks are for those, what are the potential benefits, your reasoning for choosing certain therapies, and you're communicating in that written form to other subspecialists, there's potential for patients to get the wrong diagnostics and treatments. So the patient's prognosis really depends on good communication. Also, the communication skills are on public display nowadays on the internet. Patients look up your surveys, and those surveys most of the time on the internet are talking about your ability to show your compassion, your ability to explain their disease process, whether or not they trust you, and you spend most of your time with patients communicating. You might spend just a few minutes in a 30 or 60-minute visit doing a physical exam or reviewing lab work and such. Most of your time you're spending talking with patients. And so that gets displayed online. Also, nowadays, hospitals are reimbursed based on how patients perceive your quality of care based on communication. So I put those 3 questions down there at the bottom of this slide. These are actually the specific questions that patients are asked every time they're hospitalized. After they've been out of the hospital for just a week or so, they get a survey, and it's 24 questions, but there are 3 regarding the doctors themselves. How well did your doctor treat you with courtesy and respect? How well did your doctor listen to you? You got to learn active listening skills. How well did your doctor explain things in a way you could understand? So this is why admissions committees want to know that you are a good communicator. The other aspects of the personal statement, the things that you're actually communicating, are your personal qualities. The admissions committee knows that everybody who's applying to their medical school is smart and they're hardworking. They've gotten through all those years of junior high and high school and undergraduate college, and they've got decent grades. But who are you? What's going to make you a good physician? What inspires you to be a physician? What inspires you just to grow as a person? And you don't want to just list these things. You want to show through examples of specific experiences. You want to put together a picture. And I know there's a limit in terms of how many words you get in a personal statement. You're going to submit, I'm not sure where it's at today, not much more than a page or 2 on your personal statement. But so you want to be really concise about what you're describing, but you want to be illustrative. And one of the things that you want to share is the quality of humility, because one of the most dangerous personality traits that a physician can have is arrogance. And there's a lot of reasons for that, but it's one of the classic ones that can lead to a lot of problems with patient care and collaboration and teamwork. So you want to demonstrate that you are humble, that you're able to learn from experiences. All of physicians make mistakes in patient care and working with patients, and you want to show that you're able to learn from mistakes. That's a sign of maturity and your ability to evolve as a physician over your career. So you want to probably share something about that in your personal statement. And then you want to convey, you want to have a paragraph probably about some nuances of the challenges of practicing medicine. And what talents and experiences you have had that specifically will help you as a physician navigating the challenges of practicing medicine. Those challenges are, a lot of those challenges have to do with uniqueness of every patient. Patients come with their own sets of ideas about what medicine is, different health literacy, different values. And you want to be able to show that you can navigate that. There's a lot of issues with the economics of medicine and working in teams. And I can answer any questions about those things too later on. And then you want to have throughout your statement displaying your values and your goals. What values do you think are most important in being a physician? And that's really going to be from person to person. Being able to share that is going to tell them more about who you are. All of us evolve as we go through our careers, through our training, as well as our long-term careers. What inspires you to grow in a particular direction? And it doesn't necessarily have to be what kind of specialty you want to go into, but who are the people in your life that inspire you to evolve? And then how will these values impact your actual practice of medicine? And you can, again, give specific examples of, an experience that influences your development of your values, your inspirations, and how those evolve your goals. And you should talk about if your goals are flexible in medicine. It's good to explain why that is. And that brings us to interviews. Interviews are basically another opportunity for them to understand who you are as a person and to understand how you are with verbal communication. So written communication, we spend most of our day with. The rest of our day we spend with verbal communication. And basically they're going to want to know that the person that they read about on paper is the person that they're going to be interacting with in their interviews. You want to be yourself. They're going to be looking for things that have to do with inconsistencies in your application, but also they just want to know that you are easy to relate to and that you're able to describe those values. One of the interviews I went to, I was really surprised. I went to Columbia to interview, went all the way from California to New York. It was kind of an ordeal of travel for me. And when I got there, I spent about 2 hours with a couple of medical students showing me around the campus and explaining their program. And I had exactly one interview that was only 15 minutes long with a physician, and he spent the time asking me about my family life experience. They didn't ask me about my goals. He didn't care what kind of specialty I went into. He didn't care about my grades. He just wanted to know things like, how was your relationship with your brother and your sister? I think he just wanted to see how I communicated and what my priorities were. So don't be surprised if you get those types of interviews. They're just trying to find out more about you as a person. They also want to find out if you're a good fit for their program. They really want to make sure that they're matching people's values and culture and goals with what they have to offer. And when you're looking at the programs and you are interviewing, the types of questions you want to ask them is to find out about the program's strengths and weaknesses and what their unique qualities are, similar to what I learned about Drexel. And you want to ask the current students honest questions about the quality of the program. One of the programs I had gone to interview, for example, the students were explaining that research was really prized at that institution, and it was very competitive as far as research went, trying to establish mentors and such. And there was actually some degree of backstabbing and sabotaging going on because it was so competitive. And you don't want to be in a malignant program like that, and you'd be surprised how candid a lot of the students will be when you're interviewing. It's also important to know when you're looking at medical schools, what their residency programs are like, because the medical school you go to, a lot of times they take the residency programs that they're attached to often take a large portion of their residents from the medical school. So you're going to have the highest chance of matching at the residency program that your medical school is at. So when that's the case, you want to choose a medical school that has a strong residency program. If you have an idea of what you might want to specialize in, then you want to look at that. For example, at University of California, Davis, where I did my undergrad, their residency program was heavily focused on family medicine. It was actually one of their mandates to increase the number of family medicine physicians throughout the country, particularly in rural areas. I didn't know at the time whether or not I wanted to go into family medicine. I hadn't latched onto cardiology yet, but I didn't want to pigeonhole myself and just kind of be on that track. So you want to know what their strengths and weaknesses are in their residency programs. Location is also important. If there's a possibility you're going to spend 7 years somewhere doing the medical school and a residency program, it needs to be someplace that you enjoy being. That might just be a physical place, being on the coast, for example, or being in a big city, or it might be the hospital itself. I interviewed at a place in California, in LA, in which every day when you walked into the hospital, you had to go through a metal detector because of issues with people bringing in knives and such, and not quite a safe place. And just mentally having to do that when you're already stressed and putting in, 60 hours a week in an environment, I just thought I put that way down at the bottom of my list. It just was a deal breaker for me. It may not be for some of you, but you just got to know your own personality and what your thresholds are, and location, environment are really important. Now I'd like to talk more about cardiology. Cardiology as a field. I think this is my opportunity to plug cardiology as a subspecialty, mainly because going over the next 10 years, there's going to be more and more of a shortage of cardiologists in our country. Right now, cardiology is retiring more physicians than are coming out of training programs. I think there's a lot of reasons for that. It's a long training process. The fellowship, it comes on after 3 years of internal medicine training. So you have a minimum of 3 years of cardiology training on top of that. You might do a couple more depending on if you're going to subspecialize. And cardiology lifestyle traditionally has been long hours, taking call, showing up at the hospital in the middle of the night. There's a lot of subspecialties where your call is really just during the day. And cardiology, we do spend some long hours. Now, because there's a shortage, there's actually more support in hiring more nurse practitioners and physician assistants to do a supportive role. And that is something that's growing nationwide as well as in my own practice. And that allows us to really focus on the most complex cases, which is really rewarding. And it also gives us some relief from the long hours. So I would say overall, the lifestyle in cardiology is improving. There's a lot of different subspecialties in cardiology, so that, depending on your personality and the way that you like to work with people, you can, in the disease process, follow people very long term. You might follow them for the rest of their life from their diagnosis, or you can engage with patients more in the short term, just doing the procedures that help them get back on the path to their health. Those subspecialties are general cardiology, in which you get to, depending on your preference, you can spend a lot of time doing echocardiograms and stress tests, and then following patients longitudinally with a lot of preventive medicine, doing a lot of counseling in terms of diet and sleep and exercise. So you get to have a holistic approach. There are other subspecialties that are more procedure-based, which are catheters and in the cardiology world. So getting into the cath lab and helping somebody with a heart attack, opening up an artery, and then releasing them to their general cardiologist is very rewarding, because you get that instant gratification. And then there's a structural specialty now that has evolved over the last 5 to 10 years, in which catheters are used in lieu of surgery to repair valves and replace heart valves. There's a whole electrophysiology subspecialty in cardiology, in which you're putting in pacemakers and using catheters to ablate abnormal rhythms. And that's a 2-year fellowship. There's an advanced imaging practice in cardiology in which you spend most of your time. It's an actually additional year of training in MRI and CT scanning and sophisticated echocardiography. And these specialties are very rewarding because cardiology is always on the cutting edge of things. There's always something more to learn. There's always some nuance that allows us to take care of our patients better. There's always hope down the line. And that's been really exciting for me in my practice. I'm a heart failure and transplant cardiologist. So I tend to get patients who are more technically challenging for the other cardiologists. I get patients who need more fine tuning. They need more hand holding. It gives me the opportunity to be an internal medicine specialist as well, because I'm working to make sure all the organs are supporting a weakened heart muscle, and also making sure that I'm keeping surveillance of those organs to make sure the heart is not failing to meet the other organs' needs. And I really have the opportunity to cure people of their heart failure. We recover a lot of hearts to normal, and that is extremely rewarding. When we can't, I get to help patients transition to having artificial hearts implanted and follow them through that support. Some of them have those for the rest of their lives if they're elderly. Others have artificial hearts to get them a bridge, as we say, to a heart transplant. And then I take care of those people with heart transplants too. And that's also very rewarding. And that was an extra year of cardiology training that I did at the University of Utah. I think cardiology is really exciting because there are moments of instant gratification, as I mentioned earlier, helping somebody who is on the brink of death and cardiac arrest in the middle of a heart attack or an abnormal heart rhythm is, you really do change somebody within minutes with some of the interventions that we do. One of the experience that I had as a medical student that made me want to be a cardiologist is I was in a room with a patient and a resident physician, with the patient having a very fast heart rate. I think it was going about 170 beats per minute, and the patient was passing out, and the blood pressure was dropping, and suddenly a cardiology fellow swooped into the room and looked at the EKG, was able to diagnose the patient within a matter of seconds, was able to go grab medication and push it through the IV, and within 15 seconds, patient's rhythm was normal. And I just thought, wow, this person's life was just saved. This woman is a superhero that she was able to do that. And that really inspired me. And then seeing patients who, come in with heart attacks and maybe spend 2 days in the hospital and are able to go home about their merry way with completely normal hearts because of that quick intervention. And then being with people through their heart failure disease process, and that chronic medicine, chronic disease process mentality of taking care of the whole person, following people for several years, maybe assisting them into palliative care, navigating with their family members or caregivers, doing that active listening and the trust and the compassion, and helping people just optimize their quality of life with whatever time they have left. I really get to have the full breadth of the continuum of care in cardiology and in my subspecialty in heart failure. So does anybody have any questions? Anything you'd like me to delve into more deeply?
Sorry, usually we do it to where everybody can put their questions in the chat, and then I would just
Okay.
answer them all. But since they're usually close to 10 or so students, but this time we only have a total of 6. So I'm thinking we could just ask their own questions if they want. So
Sure.
Luis, iPhone, if any of you guys have questions, go ahead and throw them out there.
Oh yeah, hey, I got a question. Can you hear me?
Yes, I can hear you.
Okay, awesome. Let me put the video on there. My name's Spence. Nice to meet you. Awesome when I heard it, you went to Marshall. I'm from West Virginia.
Oh, awesome.
So,
okay.
more in the Morgantown area, so the
Yes.
West Virginia University deal. But tell me,
Yeah.
what did you feel about your time practicing medicine in just the rural communities up there? What was that impact on you?
It was a very different experience from practicing in urban Philadelphia. It was interesting because the people's, when I was in urban Philadelphia, a lot of the disease I saw were in 40 and 50-year-olds from the inner city that had end-stage heart disease, end-stage liver disease, end-stage kidney disease from lack of preventive care. And they had a difficult access to care because they were having to transfer using, a couple of different bus rides and subway rides and such to get to us on meager incomes, if anything. And getting into that rural environment was a very different attitude toward medicine, because in urban Philadelphia, there was a lot of mistrust. And just kind of this perception that doctors weren't really there to support them, as opposed to just kind of do their thing and earn money, I suppose. And there were some bad experiences in Philadelphia, including syphilis experiments that were still just still on their minds. So I had that to contend with. When I got into West Virginia, I saw that what they had going on there was a lot of genetic problems with coronary atherosclerosis. I had patients who were in their 20s needing bypass surgery, having heart attacks because of this genetic propensity. Also, the environment promoted coronary artery disease because a lot of them were on Mountain Dew from about 5 years old. Some of them were smoking at the ages of 7 and 8.
Yeah.
I get the 17-year-old in my office with palpitations, and they're drinking a 2-liter or more Mountain Dew every day. Like, okay, let's tone that down. And then, the coal industry is there, and there's, a degree of chronic inflammation in the arteries from, poor dentition. The diet was very difficult. People, there are food deserts in urban Philadelphia where people just really have the liquor store to shop at for their needs. But in, rural West Virginia and Wayne County, we had a lot of patients from Wayne County who just had a hard time getting food. I had a gentleman who I was seeing for a heart problem, but he was in the ICU due to a gastrointestinal infection that had made him septic. And he was fighting for his life. And he was telling me, with all his belly pain, I should have just told my brother we shouldn't have eaten all that rotten food. His chicken coop had burned down. His car wasn't registered. He couldn't get into town to get something to eat. And he was eating the rotten food that he had on his property. And this is America, you shouldn't be seeing that. But rural America, I don't think people really understand what the challenges are. There was, in West Virginia, a really profound gratitude for what I was doing there, that I really appreciated. But there was also kind of we just kind of deal with the cards that were dealt kind of attitude as well, and not wanting to do too much. Like a fatalistic kind of attitude amongst a lot of my patients. So persuading to do really advanced therapies like internal defibrillators and things like this, they were very conscious of how much is this going to cost? Is it going to burden my family to do it? And maybe I just ought to live with the life I was given and not try to interfere, that sort of thing. I mean, it was just the decision-making process was very different.
Oh, thank you, Dr. Willis.
Yes.
So I have a question. What school in LA was it that required everything?
It was a subsidiary of UCLA, and I'm trying to remember, it was in LA County, UCLA Harbor. That was the name of the program.
Got it.
Yes.
And then questions that were texted to me. So why did you consider yourself a non-traditional applicant, and how did you show that journey in your personal statement?
The traditional applicant is one that goes from high school to a university, a 4-year college, and majors in some science like physiology or chemistry, biology, something, maybe even math, and goes on to medical school. And a lot of people think that they need to be motivated to be a doctor from, you know, a young age, and maybe have some experiences in life that, you know, a loved one who died that made them think about medicine or something like this. And really, I took a circuitous route through school. I went to community college for about 3.5 years, not 2. California had a very good community college program, but I needed to work in between semesters and things, and, you know, support myself. So that was a big part of it. My 2-year university was about 2.5 years because I stayed longer to actually participate in the peer counseling program. And I think that the non-traditional component, I wanted in my personal statement to show my perseverance. I'm getting through a longer college process. Explain why I had these gaps in my education, that I needed to work, and that displayed my work ethic. And I needed sometimes to take 6 courses in a semester instead of 4, and my ability to get A's in those courses, even though I was taking an extra load, I think, you know, showed my ability to have stamina. And then I wanted to show how I could juggle a lot of different things in my life at once and still be successful. And then later on in my residency and in medical school, so my husband was with me really from the beginning. We met in high school, and I was non-traditional in that I had a baby in medical school in my 4th year and was 8 months pregnant when I was interviewing for residency programs, which is a challenge because when you are having children in residency and in fellowships, it really puts a strain on those programs to get rotations filled and such. So I really worked hard to minimize those things. And then I was also 8 months pregnant when I was going through the interview process in cardiology. So I don't know if that hampered me. I really applied twice for cardiology. So there was a lot of different reasons for that. Some of it was politics at my internal medicine residency program, but everything worked out just fine. But perseverance really is one of those qualities that you want to have when you're going through this whole process, and not giving up.
Right. So where are you initially from? Because you've kind of been all over the place, it seems like.
Actually, my early childhood was in Reno, Nevada. My parents are both from Reno, Nevada, and my dad's job transferred us to the San Francisco Bay Area when I was 9 years old. And so I grew up in suburb of San Francisco in Fremont, California, if you guys know where that is. And then I went to UC Davis for my undergrad, which is in the middle of Northern California.
Right. All right.
Yeah.
The next question, if you didn't do cardiology, what other specialty do you think you would have done?
You know, I decided on cardiology when I was in medical school and having experiences in rotations. I loved being in the cardiac intensive care unit. I went to a school then that had a big cardiology program, so I got to see all of that. When I first got into medical school, I thought I would be an internal medicine specialist. So I thought that I would take care of the whole person, that I would know everything that there is to know about the human body, and I'd be practically omnipotent, omniscient, and just take it all on. But I found through the first 2 years of medical school that there were a lot of subjects that I really wasn't that interested in. And with my psychology background, I thought at least I would want to do something that I'm helping people in end-of-life decisions, helping people with the psychology of taking care of themselves, counseling people in lifestyle management. So then I started kind of looking at maybe oncology would be the obvious thing, but then my courses in oncology were pretty dry when we were looking at staging, and looking at things under the microscope was interesting, but not the way I wanted to spend my life. And that was pretty dry. Learning all the chemotherapy drugs, this isn't working for me. I can't get all that in my head. So just looking at pharmaceuticals, this pharmaceutical class informed me a lot. And then when I was learning cardiology and we were going through those courses, everything just clicked, and there was a lot of physics in cardiology, and I really was good at physics, or the processes, it just made sense. Things were just really obvious to me, and I could learn it really well, and I liked the language of it.
All right. And then what went into your decisions on medical school? Like what made you decide between Drexel or Columbia or any of the other schools that you were accepted or had an interview with?
I think my growth as a person and what I valued as a physician probably did come from some experiences that I had as a teenager interfacing with the medical field. I watched a family member struggle with a disease process that was really debilitating, and she had some bad experiences with a couple of physicians, and I just thought, we got to treat the whole person. I want to have more of a good doctor-patient relationship, and I want to see if I can further that in my own community as a physician. And Drexel, at the time it was called MCP Hahnemann, and it was the first women's college in the country, and then evolved and partnered with some other schools. And then Drexel bought that out because Drexel had this engineering program that was really excellent, and they wanted to get more in medical engineering, dual degrees and things like this. But when I learned about Drexel and how much they valued the doctor-patient relationship, and that they were pioneering how to teach that to students, we had twice a week, we had sessions where we had to learn active listening skills and practice those. And we would go into the hospital and learn those communication skills, practicing with patients. And then we had rooms that we had videotaped our interactions, and we'd get critiques on that, we'd get feedback, and they really were starting that and then starting to share that with universities around the country. I just thought they had a really, really good core set of values, and that's how we decided there.
All right. And on one of your slides, you mentioned for your personal statement to kind of talk about whether or not your goals are flexible. Do you think that's important to have, or if you kind of are set to something, but you're open to suggestions, like, is that also okay? Or what do you think the admissions boards prefer?
I threw that in there because I think it's important for people to know that you don't have to know everything about yourself. You don't have to, we know that you're going to have so many different experiences in your medical school training and your extracurricular activities. It's okay if you don't know what you want to do. If you are really set and you have good reasons why you want to be a cardiologist or an oncologist, you basically just want to be able to explain the why of things. And it is good to share experiences. You may not have experiences that give you the why, but you just want to be able to explain why you're so driven for a particular specialty, or why, hey, I'm just open. I have, these are the kinds of things that I'm drawn to. This is my personality. These are my values, but it's okay to be open. It's okay to be flexible about your goals. And to show that you're willing to evolve as a person is what's really important. A lot of growth happens in medical school and residency.
Right. So what was your personal statement writing process, and do you have any suggestions for us on how to get that started?
I think taking the list of topics, I don't know so much of medical schools are my experience in medical school was there was just kind of this uniform personal statement that could apply to anywhere. And then if they like that well enough, they would ask you to then answer some specific questions that were kind of similar to the person's personal statement, but gets into more detail. So when the things that I provided there in terms of topics, you're not going to hit all of those, but to just start brainstorming, doing that introspection process, thinking about how you decided to come to this point in your training and in your career, deciding, okay, this is it. I'm going to be a physician. This is a huge step. This is putting me on a path that is expensive for a lot of people. That's going to involve a minimum of 7 years before you get to graduate in, minimum, and be an independent person. You're going to be 30 years old or more, whereas some of your people who are graduating from college with their 4-year degrees are hitting it and they're living their lives independently. So how do you evolve to take that big step in your life? That introspective process is really important. And as you go through that process, just writing down anything that you're thinking about in terms of your experiences, relationships that you've had, people that you look up to, brainstorm and brainstorm and brainstorm. And then go through the process of figuring out how to illustrate that through personal experiences. And then going back to your basic English classes in like advanced high school and into college, of that, introduction, catchphrase, that gets somebody hooked into wanting to read further. Hey, this person might be interesting. And that intro paragraph, and then those 3 or 4 that get into each topic, and that conclusion that allows them to kind of summarize who you are and leaves them thinking about you. It's just that classic kind of formulaic. That's how people want to see it. And then rereading that and fine-tuning the grammar, fine-tuning the way you're transitioning your paragraph so it stays interesting and that it flows. And having other people read it, people who have good English skills, as well as people who know you. If you have people who know you read your personal statement, they're going to be able to say, hey, you know what, you could really elaborate on this, because this is what I think of you. And they might even point out qualities that you might not even realize you have or that are important because you take them for granted. So talking to other people is also a good part of developing your personal statement.
So on that, I've actually heard that you should limit the amount of people that you let read and kind of suggest what path you should take with your personal statement. Would you agree, so you don't kind of get all this mixed information and then not know what to do with everything?
Yeah, I mean, you could get overwhelmed. I think it depends on how you are as a person. If you're able to take in a lot of information and filter it and consolidate it and make it your own, take in as much recommendations as you feel like you're capable of. If you've got 2 or 3 people that you really trust, that are good at writing and communicating and know you, then stick to those because you trust their opinions.
Got it. Well, those are all the questions I have lined up. So Spencer, Luis, and whoever else is out there, if you guys have any questions, feel free to throw them out there. All right. I'm gonna go.
Okay, I got another question for you, Dr. Wills.
Spencer,
Sure.
thank you.
Yeah, so as far as your process of going to medicine, so I'm a non-traditional student. I've worked for 5 years in social work, specifically social work with veterans. How was kind of your experience going from working with people in a case of helping them relieve their societal stresses, kind of transfer into helping them relieve them from their physiological and health stresses, and just what's that process been like for you?
I think it helped that when I was going through medical school and doing psychology classes, that I did learn a lot of the ways that the mind and emotions, adrenaline, things like this affect the physiologic state, the ways that stress, when we look at cardiology, for example, we know that people who come out of a hospital with a heart disease diagnosis, particularly after a heart attack, they do have a higher rate of depression. And if that depression isn't managed well, they are going to slide into a worse prognosis with their heart disease. And being able to communicate that to them, frankly, and that you care about how they feel about their disease process and not just taking care of their body as a science project, that's really valuable to them. And having that sociology background would make you more capable of communicating your compassion toward people and treating them as individuals and understanding their challenges. understanding the economics of healthcare and where those challenges are. Those lifestyle management things, everybody's got a different thing, but it's really critical to be exercising on a regular basis, but there's a lot of obstacles to doing that. A lot of it's up in the head, because most people can find 15 or 20 minutes to do something, but then there are people also have a lot of physical disabilities that keep them from exercising, and just knowing that that's important. Helping people with their diet, helping people overcome their obesity, and helping people with their sleep, all of that is integrated. And I think it applies to a lot of different disease processes, but particularly and as an end result in cardiology, and helping patients know that they know that all of this is reversible. It's never too late to start. So I think just keeping the whole person in mind has really been helpful, and a sociology background really helps with that. In fact, I'll let you know, because you let me know your background. We are in the process of hiring another heart failure doc, and she is currently at Cedars-Sinai doing her heart failure and transplant training. And she let us know that her major in college was sociology. And a lot of her extracurricular activities through medical school and residency were even award-winning sociologic and humanitarian experiences. So that really is a strength for you, even though you're non-traditional and you have some years of experience under your belt. That's actually helpful.
Can you kind of go over the follow-up process? I know you said you'll follow up over years and years. What's a typical follow-up for you to ensure that you're giving genuine but helpful care for your patients that you've been looking over?
Well, in the heart failure world, we micromanage our patients, because there a lot of times in the early stages of the diagnosis, patients really are quite tenuous, and we need to know that we're crossing every T and dotting every I. So I have a whole team. I have myself, we're going to have another doc. We have a nurse practitioner, we have a physician assistant, we have 3 nurses, we have medical assistants who are helping us keep track of patients and making sure they're not falling through the cracks, both in the clinic environment as well as in the hospital. So one of the big problems with heart failure care is a lot of patients, once they've had a hospitalization, they'll have multiple hospitalizations, and they cost the system a lot of money. They can cost, a couple $100,000 a year if we're not keeping track of all of the nuances of their medical care and the whole person, as I mentioned before. So we actually have at our hospital a heart failure guidance council, in which we're engaging with cardiac rehab specialists, hospital nurses, social workers, home health nurses, to make sure that patients are getting every single thing that they need in order to be successful. And sometimes that's just helping them fill out their Medicaid paperwork and their disability forms. Other times it's making sure that they're getting their blood pressure and their weights checked on a regular basis, so that we can make medication adjustments. And they will come in frequently, maybe every couple of weeks, to make sure that they're going in the right direction. And that's where our success lies. So we have a lot of frequent follow-ups. And then once they're doing well and they start coasting, they've maybe recovered their hearts to normal, or they're still maybe halfway there, but they have decent quality of life, we might see them every 6 months or every year.
Okay, thank you, Dr. Willis.
Yeah.
All right, so I think there aren't any other questions. Well, actually, sorry, there's one, but I'm going to end it with this question. So if we ever reach like a post-COVID society again, would you mind having students shadow you, or is that not something that's particularly easy in your field?
Yeah. No, I love to have students shadow me, medical students, pre-med students. Our team has been understaffed this past year. We've had a couple of people out, and a lot of people are moving into St. George, as you know, a very fast growing town. And so we're adding a lot of new patients, and our patient panel has grown to more than what we can handle. So I actually put a hold on having medical students for now, but yes, probably 6 months or so. Probably 6 months from now, we'll probably have the time too, because when I have people shadow me, I don't like them to just shadow. I want them to learn while they're with me. And I want them to learn all the whys of what we're doing with patients, and do a lot of teaching, not just having them observe. So I want to be able to put good time with it.
Right. Well,
Yeah.
thank you for that. And
Yeah. Of course.
is there anything else you want to say before we end? Or Louise, Spencer, again, if there are any questions?
I'm a
I mean-
resource for you guys. I'm still available if you have any other questions. So just give my email and contact me.
Got it. So would you mind if I shared the email with people who attend this?
Yes, please do.
All right. I'm going to put it in the chat so that it's also in the recording.
Hey, Colton, I'm on my phone, not a computer, so I can't really see the chat.
Okay, I can text it to you as well.
All right, thanks, dude.
All right. And that's correct, right? Carrie.willis@imail.
Yes, that's right.
Awesome. Well, I don't think there are any other questions. So thank you very much for your time.
Yes, you're very welcome.
Presentation.
Great. Let me know if you need anything else.
Sounds good. Thank you very much.
Okay.
You have a great night.
Yeah, take care, guys. Bye-bye.